Ciao mondo, hello world, hola mundo, hello mon, konnichiwa, ni hao, namaste. We're here today in the Vicenza Conference on AKI, CRT, ECOS, and Critical Care Nephrology with Professor Kashani, who just delivered the lecture on artificial intelligence. And Kianoush, I'm here with a lot of data in my PC concerning different patients with AKI and so on. What do I do with all this data? How can artificial intelligence help me with this?
That's a major problem, because now not only we have a lot of patients with acute kidney injury with data, we have a lot of data on each patient that we didn't have access to before. So the easiest way that these tools can help us is to classify this data to patterns that we can approach differently. So pattern recognition is something that computers do really well, and they can help us to manage our patients more directed or precisely, expecting that this at least improves process of care for them, if not the clinical outcomes.
As you know, we are enthusiastic about new technology, but we should also be careful. What are the risks of these tools in terms of the human approach to patients?
This is absolutely correct. Outside of the fact that a lot of this has resulted in a lot more information, including alarms that make us fatigue, and we don't pay attention to them anymore. Sometimes there are unintended consequences that these devices cannot actually take care of a subgroup of patient population. They discriminate against a group of population that were not participating in the original studies to validate these models. And they can recommend things that, so example of that, you remember MELD score is now used for liver transplant. For years and years, it put females in disadvantage because they have less creatinine. So they got less MELD score. How many females got needed liver transplant but didn't get liver transplant due to that fact? Just God knows. So we have to be able to kind of monitor this, make sure that we mitigate that risk. Also monitor it in the future to make sure if there is unintended consequences, we manage them appropriately to avoid this discrepancy in the care.
So I know that this is a moving topic and area. What is the next step, let's say tomorrow, and what is the next step in 1 or 2 years from now?
I think that we are in a really good situation at the moment. The technology is growing really fast. One of the reasons that so far majority of studies didn't show drastic improvement is that technology is still not at the point that we can rely on to take care of a lot of stuff. Unfortunately, physicians, you and I are both physicians, we are not good with compliance. We have mind of our own. Even if there is a recommendation to do certain things in AKI care bundle, majority of us don't do it, and data supports that. Unless these devices can become self-sufficient, they do automatically things that are not really expensive or invasive, then we cannot expect significant improvement. Regardless of how much information they provide, how accurate they are, if information does not translate to patient care or change of our behavior, is not going to impact patient outcome. So hopefully technology improvements or compliance would result in better performance of this model.
Last question, which has nothing to do with science, but just philosophy. Will ever this device get consciousness?
Well, this is a very difficult question. So fortunately, for time being, for foreseeable future, we don't expect them to have any feeling. But recent generative AI, which is a kind of AI that generates new material, has had some hints that they can have some feelings. There are some AI models that if you put them side by side in your cell phone, they actually start talking with each other and they become sad or happy. And if that is just based on what they learned from the data, or this is something that they feel is subject to see.
Is the future bright, or there is a little dark side?
I think the future is bright. I always look at the full half of the glass. Obviously, we need to kind of make sure that these do not cause damage than benefit. So we need to mitigate the damage.
Well, thank you very much for joining today, Cappuccino. Thank you, Kashani, and have a wonderful, wonderful day. Excellent.
This is excellent.